Okay. Alright, your afternoon is complete because I'm in the seat. Nortey by nature. That's right, a Ghana month. Celebrating everything Ghanaian. Wacha mwejenyo. Kefio vitayona. Mintra dafiake. Program any and leaka chole ultimate ete. One day she be an no. Okay, well, man, la jin song about try. Oh, now I mean, music, man, eh? You know, man, he pose one more. Joy. Month edition of Ultimate Health on Joy 99.7 FM with me, Nortey by nature. A great remix. CK Man born in 1936. Sadly, we lost him 2018. Omahini Pozo. Sadly, we lost him as well in 2016. This one's called Asafu Besan. Or say about train pana mean to mean nintina. Obeko ochina. Oh, Ghana is good, huh? But let me now play you the original Debt Exchange. The original Debt Exchange song, yes, way back. There were haircuts, huh? And we got songs that talk about that haircut. This one is by A.B. Krenzel, huh? Check it out. You ask for a haircut. You restructure your debt. Yes. A.B. was doing this long ago. And he said, yes, I will pay you tomorrow. Dondology.
Too much wahala in my house.
Joy 99.7 FM.
I gonna pay you tomorrow. Aye. My wife they shout for money. My children they cry
Joy
for joy.
99.7.
Haircut started with a quarter, then went to half.
I gonna pay you.
Make no mistake, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Ghana Month edition. This month,
I gonna pay you.
what have we done in the years past? We've talked about white chalk, ayilo. We've talked about circumcision. Yes, we brought in a wanzam. We talked about tribal marks with a plastic surgeon.
I don't know when I go
So Abeku and I are revved up
tomorrow. Aye.
for Ghana Man, but you're welcome aboard today. 9 minutes past the hour to a bit of a long intro because I crossed over into a new level. Yeah. Last week was my birthday. Those of you who think my birthday is 29th, please be careful. Be very, very careful. 28th. But today we're looking at rheumatoid arthritis. Yes, an autoimmune condition. I have in the studio Dr. Richard Doe. He's a specialist physician with the rheumatology unit of the Kolebu Teaching Hospital. Next to him, Franklin Hiagbe, patient advocate and subgroup leader of the Rheumatology Initiative. Franklin, you're no stranger to this show, are you?
No, I'm not.
Yeah. You've been here with Dr. Jifade before.
Yes, sir.
Right? And you're living with the condition.
Yes, I
Yeah,
am.
and you're smiling. So you're the right person to tell us about it. We'll look at life with RA or rheumatoid arthritis. Next to him, Dr. Richard Doe, specialist physician with the rheumatology unit. Doc, you're familiar as well.
Yes, please.
Okay, where did we meet? Not at the Petish Bar.
No. In Kolebu.
In Kolebu. All right. Okay,
yes.
Great to see you. Where do you hail from? Where do you come from?
I'm from Pode in the Volta region,
Okay.
and it's in the Northtown district.
Oh, where my troublesome Presecond is your MP, yeah?
Yes, please.
Right. Is there a name for this condition you know of in any of our languages? I've been trying to research. I didn't finish.
No, I have not come across.
All right.
I mean, they would just describe maybe the pain.
The pain. Okay. Right. Franklin, where do you hail? Where do you come from?
I come from Adaklu Amfoe.
Hey. So today, dear,
The Volta.
we have to do ultimate health in ever.
Akpena.
So how do you just reach out to my listeners before we get into the business in your language? So Doc.
Yo, apato midbe mi adogwe na mi. Ghana month nye ya mi galama kaka mi ha midbe alabe mi ano la masema. Eta midbe mi aglo dolole ya oyo na be rheumatoid arthritis ye vugbama. Midbe mi anyan na nutung na made le do malama no ata ava mi agbana mi akpogbo kaba. Akpena mi.
Wow, akpe. I heard Yevu in there. That's white man.
Yes.
Yes, yes.
Okay. Dole.
Yeah, sickness.
Dole
Yeah.
meant sickness, right?
Yeah.
Okay. Ultimate. Franklin, don't dodge. Don't megaleswevo. Megaleswevo.
That's a guy.
You must have.
So Franklin, how do you introduce yourself to our listeners in your language?
Yo. Nkonye Franklin Hiagba. Abaleka obia tongwa mocho Adaklu Amfoe. La hu fakpaji. Ta abaleka Dr. Gble na nyanya mula dolam. Akamota eka ole junior pomu data. Na do na miatan pom la TV je fi amala la masasama.
Okay.
Ta ita ko mi vado bada mia ado je ple mia o ha na mia nya do ya prengi ko la ba mia wo ekene mia ha mia no la masasama.
Okay. Akpe. Mr. Gome.
Yes.
I understand.
Yes, that's it.
Right?
You're doing well.
But the only thing I heard in yours was TV. Folks, yeah. His was a bit too okro-like.
Yes.
Is it the same, should I say dialect of it?
No, it's not the
Let's
same.
slide.
There's a difference.
Yeah.
Yours, what is yours?
My own is Tongbe.
Tongbe.
Yes.
All right.
It is
Yeah, it's
Anglo.
Baduma.
Baduma, okay.
Hey, folks, Our country, eh? All right, lovely. But thanks for coming and joining us to educate, empower our listeners, inform and transform. We've been doing this for a while. Ghana Month, we've been doing this for 10 years. So we try to blend on all our program platforms, right? And sometimes we take things that are from our culture, from our beliefs, and so on and so forth. We have interesting beliefs about twins. You'd be amazed, right? So even Ultimate Health listeners, we are able to thread and create this beautiful tapestry. Should I say, bridging our culture, our tradition, our beliefs with health. So, Doc, coming to you, I mentioned that rheumatoid arthritis is an autoimmune condition. Can we explain what it is for our listeners?
So rheumatoid arthritis is an autoimmune condition, rightly as you said. When we say autoimmune, what we mean is that your own immune system, normally your immune system fights against infections.
Okay.
Anything that it sees as foreign, it will try to prevent you and keep you safe. But for people who have rheumatoid arthritis, this autoimmune system has rather, if we like, it gone haywire and is destroying their tissues, and normally it destroys their joints.
Right.
So tissues around the joint.
So your immune system is fighting itself,
Yes.
right? And destroying body cells,
Great.
not enemy or alien cells,
Good.
right? Not disease-causing cells.
Yes.
Okay, right. So when it is rheumatoid arthritis, then it's destroying or attacking the cells of the joints.
In the joints.
Okay.
It can also go to other places, but normally it destroys the joint. But
Okay.
we say it's a systemic disease
Okay.
because it can go to other systems. Your
Okay.
eye, your lungs, your heart.
Right. Okay. So we'll get to why my immune system will misbehave like that. Okay.
Yes.
But so let's look at the disease and its progression. How does it attack joints? Okay. Again, my understanding is joints are made of a meeting or a junction between bones that move. Okay. Can you break it down a bit?
All right.
How does RA affect the joints?
So, RA, your immune system will attack the tissues around the joint. So
Okay.
each joint has got maybe two bones and what we call ligament and synovial fluid.
Okay.
So the RA will develop inflammatory cells
Okay.
or cells, if you like. Just forget about the big words. So these cells will attack these joints
All right.
and will attack the tissues around the joint. So
Okay.
these ligaments and then synovial fluid.
Okay.
And they'll become inflamed. So they become very red,
Right.
inflamed, and with time they are destroyed.
Okay.
So they become very painful. Every slight movement is painful.
All right.
And this pain tends to come on early in the morning.
Okay.
We say it lasts more than 30 minutes. So if you had this and this has been going on for more than 6 weeks, then we suspect you may be having rheumatoid arthritis.
Okay.
So normally this pain should have been on and off for about 6 weeks because it can mimic other conditions.
Okay. I know there are other things that can cause pain in the joints, but let me establish. So we're saying that our joints normally, right, if everything is okay, should not be painful.
At all.
Movement should not be painful.
At all. God has made it in such a way that there are fluid there
Okay.
that greases the joint
Right.
and prevents pain.
All right. So our joints are divinely lubricated.
Great.
All right. And that lubrication is the synovial fluid,
Good.
right?
Good.
So every joint, so even if it's the joints of my
Fingers.
my shoulder, my knee, my elbow.
Movement should not cause pain.
Okay.
If it causes pain, something is wrong.
All right. You're not a dietitian, but let me go to diet small
Yes.
because we like bones. Yeah,
Yes.
kedompe,
Yeah, yes.
Right? When we travel, people worry when we are consuming the bones at table.
Yeah.
The grill part,
Yeah.
cartilage or whatever it
Yes,
is.
yes.
Is that what is also being destroyed and damaged?
Great. That is also being destroyed. Good. So
Okay.
the gregro part is also part of the tissues that prevent the bones from meeting each other.
Okay.
And so if you have rheumatoid arthritis with time, that gregro part will also be destroyed.
Okay.
And you can actually have what we call secondary osteoarthritis.
Okay. Right. Doc, still with you. My reading suggests that the art part is to do with the joints.
Good.
And the arthritis or
Is the
ritis
pain.
part is the pain
Pain. Yeah.
caused by the inflammation.
Yes.
Is that right?
Yes.
So is it right also to say that arthritis in itself is a condition different from
rheumatoid
arthritis.
So rheumatoid arthritis fall under the big heading arthritis.
Okay. Which is what? Inflammation of the joints.
It's inflammation of the joints.
Okay.
So there are different types of arthritis. There's an arthritis that most people know, which is normally due to wear and tear. We call osteoarthritis.
Okie dokie.
So that one is different from rheumatoid arthritis.
And therefore not an autoimmune.
So the osteoarthritis, or if you like, OA, so that people can remember.
Okay.
OA is not autoimmune.
That is no. Is that? Would I still say that is normal wear and tear?
That is normal wear and tear.
Okay.
That is also arthritis.
All right.
And most of the time, when the general public say arthritis, they mean OA, osteoarthritis, which is wear and tear.
Right.
But rheumatoid arthritis is your immune system that is destroying these joints.
Okay.
So there's nothing like wear and tear.
Okay.
Whether you use it or not, the immune system can attack it.
All right.
And it can attack. So in that case, it can affect all ages,
Okay.
including children.
Right.
But you see, OA, because it's wear and tear, you should have used it for a long time. And so maybe whilst you advance in age, it shows.
All right, great stuff. 19 minutes past the hour of 2 on Joy 99.7 FM with me, Nortey by nature. The program is called Ultimate Health. The dial is 99.7 FM. Make no mistake. Yeah, listen, every Sunday we do this, right? We educate, we empower, we inform, we transform. And if it affects and impacts on your life, your well-being, look, we'll bring it into the studio. That's what we're doing this afternoon with Dr. Richard Doe. We have a Richardson Doe here. Are you related?
No.
You're not related?
Yeah, okay. I've heard of him.
Okay, great. He's a physician specialist with the Kolebu Teaching Hospital, and he's at the rheumatology unit. I'll get him to break down rheumatology so you understand his area of specialization. Next to him is Franklin Hiagbe from Adaklu, right? Yes, he speaks a certain dialect of ever you can download on Google Store, right? But he's here specifically because he's affected. He lives with the condition we are talking about, okay? So he's the horse's mouth that we will be listening to, literally, right? But he's also a patient advocate with this grouping called the Rheumatology Initiative, right? Mamaga Jifade. I'm greeting you, right? So Franklin, when did you get to know, though I'll deal with diagnosis and other things with Doc, when did you get to know you had this condition?
I would say I finally got to know in 2015.
Right.
And this was after 2.5 to 3 years of trying to figure out what was wrong with me.
Okay.
Yeah, so in 2015, as you mentioned, Mama Gajifade did the diagnosis, and not first time I heard of it, but then I got to know that I actually had it. Because prior to that, a friend of mine who was also in medical school at the time, I think she probably remembered her notes from class and was like, these things you keep describing, they are sounding to me like RA. So I asked her what is RA, and then she explained, and I was like, so when the next time you go and you see the doctor, maybe ask them if you've read about this and you think your symptoms mimic it, so maybe they can check.
All right.
So the next time I went, I mentioned it, and then I was referred to Kolebu. I think I was referred to Kolebu first to the orthopedic center because they had done the test and found out that some form of osteoporosis was happening in my fingers.
Okay, hang on. What do I... Bojidi.
Yeah, Bojidi. Yeah.
So, before 2015, share with my listeners, what were your symptoms? What were you experiencing that you hadn't yet figured out? That hadn't yet been diagnosed?
So, for instance, the inflammation and pain doctor spoke about, I was experiencing them.
Where?
Well over. So, in my elbow.
Your elbow.
In my wrists.
Your wrists.
And then in my fingers.
Okay.
And this had gone well beyond the 6 weeks he spoke about.
So was it there all the time? Does it come and go?
Yes, so it was intermittent.
Right.
It will come, it will be there.
I'm using easy, intermittent and come and go. You wait. When you finish explaining, I'll let you explain or give me the ever word equivalent for intermittent. Yes, so continue.
So it would show up and it would get messy, to show up,
Alright.
it would get, and it kept moving from, let's say, from one joint to the other,
Okay.
right? So there's something maybe Doc would talk
Yeah.
about later about it being symmetrical.
Be on
So,
both sides.
Yes, it
Right.
happens on this side and then it will transfer to the other side. And as he said, it was more painful in the morning.
Okay.
And then I would have stiffness
Mm-hmm.
in the joint, so in my hands. So
So moving your
I
fingers, your
can't
wrists.
I can't clamp a fist when I
You
wake up.
can't
and,
make a
know,
fist.
Yeah, it would have to be, let's say, after 30 minutes to an hour before my hands will begin to warm
So
up.
essentially, you're losing function.
Yes, I was losing function.
Apart from the pain, right? You're losing function,
Yep.
ability to move, control your fingers, your wrist, and the joints you're talking about.
Exactly.
And you didn't know what it was.
And I didn't know what it was.
Okay, then you met Mamaga.
And I think the final one was the fatigue.
Okay,
I'd never experienced it before.
okay.
It was the first time, and it felt like there was this heaviness pulling me down. So
Right.
you can't get out of bed, you can't do like regular things that you'd want to do because
Right.
you felt like you've kind of like worked the whole night and you are now wanting
just
to go to sleep.
Exhausted, tired.
Yeah.
Wow. Folks, 24 minutes past the hour of 2 on Joy 99.7 FM. The program, as always on a Sunday afternoon, is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. We're learning about rheumatoid arthritis, okay? Separate or a subsection of arthritis, right? A type. But this one is caused by your immune system attacking the cells and the structures of your own body. Okay, I have Dr. Richard Doe here. He's a specialist physician with the rheumatology unit of the Kolebu Teaching Hospital, so I don't have to think plenty, right? I can go and read, but really not my territory, right? So coming back to Doc, by the way, if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and I hope the sound and the visuals are at par today. I know some of you like sending me the difficulties you're having online, but we're grateful each time you join us. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. And shortly, I will, join us, since we're talking about joints, by activating the phone lines. If you have any questions, concerns, experiences. So, Doc, just listening to him.
Yes.
Okay, of course, I've heard his story before. But somebody goes through these things, right? He mentions that it's symmetrical in the sense that with RA or rheumatoid arthritis, it presents on both sides. Okay, so if it happens to the wrist, it's likely to happen to the wrist on the other side.
Great.
Whereas OA is not like that.
Yeah.
Okay, let's talk about that. So it means you can distinguish, but you haven't diagnosed yet.
Yes. So for rheumatoid arthritis, as he said, you tend to have pain. And we say that normally rheumatoid arthritis will start with the small joints.
Okay.
So your fingers, your wrist.
Okay.
Before later on, it could go into the large joints.
Okay.
So both rheumatoid arthritis and then osteoarthritis can affect your knees.
Okay.
They can affect your hips.
Right.
But rheumatoid arthritis likes the fingers more.
All right.
And so it will start with your fingers.
Okay.
And as we rightly said, if it starts on your right, it won't be long when it will go to your left.
Okay.
And we say that it tends to give you pain that is so severe, especially in the morning, and it lasts more than 30 minutes to 1 hour.
Okay.
So after 1 hour, it seems to wind down,
Right.
and then you seem to be quite okay. It's still present, but not so painful.
All right.
And you can have extreme tiredness. Sometimes you can have even fever.
Okay.
Because it's an inflammatory process, it gives you fever.
Right.
And that is where it makes it difficult for most people to diagnose it. Because the pain, they could either use a rub or any pain relief.
Okay.
Then it will seem to have gone down. If it comes to a fever, joint pains in Ghana here, then you know what diagnosis you are likely to be given. Malaria.
Okay.
And then if it keeps long, they'll give you typhoid. And that is why most people have difficulty in diagnosing this disease.
Okay.
Others will also just think that it's rheumatism.
Okay.
And in Ghana, rheumatism, we have local names for it.
Right.
So that means it's been with us for long.
Okay.
Now, some also will have extreme fatigue,
Right.
where they have not done anything, but they feel so tired. And that makes people think that they are lazy, but they may not. It may be the illness,
Right.
the autoimmune disease.
Right.
So they get so tired. And then others also just become anemic. And that is why people would choose to take their own medications, blood tonic.
Right.
It's not going to solve the problem.
Okay.
The anemia is not because you are losing blood, but it's because of these inflammatory processes.
Okay, great stuff. Akpe. So it means that I now need to get from you, Doc, and from my listeners, an understanding of the process of conclusive diagnosis, right? This can be caused or could have been caused by other things, but we're pinning it down and saying the culprit is RA.
Good.
How do you firmly and conclusively diagnose RA? What do you need? Franklin referred to certain tests that were done and so on and so forth. How is it diagnosed?
Great.
So that you don't go walking,
yeah.
shopping around doctors, specialists. And
So
yeah.
you may have difficulty in diagnosing it. No one is able to diagnose rheumatoid arthritis that easily,
Okay.
even in our department.
Right.
So what we do is to take a good history, listen to your story very well.
Okay.
If this had gone on for more than 6 weeks, then you are a suspect.
Okay.
Then we will now examine the joint. If we find out that things are almost in symmetrical joints, suspicion becomes higher.
Okay.
Then we'll do some tests and then some x-ray. Now, none of them, I must say, are conclusive.
Right.
So sometimes some people want to walk into the lab and do a test and say, oh, me want malaria, now me need malaria.
Okay.
No, this you can't do that test because you can even have the condition and have it in negative.
Right.
Because we have what we call seronegative rheumatoid arthritis or seronegative RA
Right. Sarah tells me you're looking for something in the blood.
in the blood. Good.
Right. And
Yes.
you're saying that you can have RA and whatever the marker you're looking for will not be present or will not be detected by the test.
Correct.
So
Yet you
norma-
still have it.
Yes.
Okay.
So normally we use what we call a diagnostic criteria
Okay.
where we rate points.
Okay.
So we take your history, we see points in it, then we mark them and then give points.
Okay.
And we put all together and we come to the conclusion that it's most likely this is not. And then we examine you.
Okay.
So you need to really visit a healthcare facility for them to take your history well, examine you well, and then do supporting labs.
Okay.
As we said, you could be anemic. So we'll do the blood levels, and if you're anemia plus all these things, then the suspicion goes higher. So unfortunately, there's no one test that could do that.
Okay.
And that is why diagnosis could delay.
All right.
And we want a lot of people to know about it.
Okay. All right.
So that they get closer to us.
Right. 31 minutes or 2:30, as they would say elsewhere. Ultimate Health, Joy 99.7 FM with me, Nortey by Nature. We're talking about rheumatoid arthritis and we're trying to demystify it.
Yeah.
Right? If you are the one suffering from the symptoms or the condition, this can be very frustrating. Right? Because you go to somebody, sometimes even a specialist, and there's still, nothing conclusive. Yet, you are suffering. So we want to pin this down. That's why we spend some time. This one says, hello, Joy. Can I have the number of the doctor that comes in on Wednesdays for the health program? That's on drive time. Lexus has Dr. Osafo, right? I'll see if Abeku can help you with that. Can I also have the recording for the discussion you had on white clay? Ayilo, please. I will try and facilitate that on condition that you send me the name for white clay in your language. All right? So I'll be checking if you're typing. Yeah, we need to know our country. We need to know our heritage and background. Hello, good afternoon, Nortey and Ultimate Health Team. Please kindly do something about the Ghana on the table.
Ghana flag.
Ghana flag on the table. All right, what's wrong with it? It's blocking you. What you want to see? No, you sit down. Abeku sort that out. I don't know what do you want. Thank you. Red, gold, green, and not green, gold, red.
Yeah, it's
okay,
10
it's
upside down.
inverted. Okay, now I'm looking at it. Hey, Abeku, you buy a goat, a pure white goat. That is no blemish, pure white, and it should be. Can a goat be left-handed? Okay, sorry. Right. Okay, thank you. Chia, these are listeners.
Yes,
One
watching
day,
everything.
a listener sent me a message saying that he felt my guest was reading, and he had a problem. Oh, good. No, where's the message now? Very insightful discussion, Dr. Doe, Dr. Day, and the entire team. You guys are extremely wonderful. I'm a very difficult patient of the team. Hey, hang on. I am a very difficult patient of the team, right? Thanks so much for being there for us. It said, it says EYEC. Okay, so I guess yeah. Okay, so do you know EYEC, or you have several difficult patients? Okay. Thanks for joining us. Thanks for sharing. Good afternoon, Nortey. And this one says Nortey. Come on here. Come on here. Over natural me Nortey. Nortey solo. Okay, well, there's an added E, right? It would be EI or something like that. Okay.
You want a full program?
Thank to Doc for touching on osteoarthritis OA. I hope there will be a full program on it. I've been diagnosed with OA and I am 47 years old, but according to the doctors, the onset is early because of an ankle injury I had through an accident at the age of 18. I have been doing physiotherapy, pain management, etc. over the years, but I will appreciate it if I know how to better manage it. Many thanks. So there's no name, but okay. Belated happy birthday, by the way. You celebrate your birthday with my older brother. This is from Essie. All right. So we'll try and see how we can facilitate that. We've done these discussions over time. Sometimes we try to converge with the international or global celebrations. Yeah. Sometimes we just yank them in because we have to. But yes, thank you. Your request is well noted by the UH team, and we will respond accordingly. Right? If you have any questions, concerns, experiences, fears, and confessions, you can share them with us. WhatsApp is 055 11 11. Yeah, people have confessions.
Yeah.
Sometimes they've been doing the wrong thing because somebody, or they've been told it's the wrong thing, but they still do it.
Yeah,
all right.
Myths and facts.
Yeah. 055 11 11 997. I'll activate the phone lines now. 030 221 6541. The Ghana Month edition of Ultimate Health, we're talking about rheumatoid arthritis. If you want to share WhatsApp, is 055 11 11 997. Okay, so we have a sense of how it can be diagnosed, but this sounds like specialist territory, right? Yeah. At what point do you transition to a specialist? And just before, listeners might get worried, I will backpedal to what causes it, okay? Causes. And then risk factors, right? Great. There's a reason I went this way. Okay. Yeah. So when do I transition? I mean, if Franklin has been walking around and still dancing around the corridors of Kolibu or wherever, when does it get referral?
So thankfully, we have updated most of our doctors, and they are aware.
Okay.
What we want the general public also to know is to know about the disease, and know also that it is not from what they say Efifo.
Okay.
It's Ghana man, so you can say Efifo.
Right.
So it's not from Efifo. It's not spiritual, and it's a disease that exists.
Okay.
So if you've had the symptoms, or you tend to have joint pains for a longer time, and you think that you visited the hospital several times, and some of your people at home are telling you that it's typhoid, go try alternative medicine. When you go to the health facility, you just tell whoever is taking care of you that you've heard about autoimmune diseases or rheumatoid arthritis.
Okay.
Please, could it be that? Okay. And I'm sure if the person runs one or two tests, listens to your story again, if he thinks you need specialist attention, he or she would do that.
Okay.
But we do not advise that you just walk in and say, well, I've come, I need specialist attention.
Okay.
You may be wrong because, as we said, it could be malaria, it could be osteoarthritis, it could be even sickle cell disease.
Okay. So, Nortey, I cannot give you specialist referral, right? But if you've listened to this and you're concerned and you're experiencing some of these things, have it checked out, okay?
Great, yes.
We have our specialists are few and far between. So we try to make sure that they are deployed for the real cases and they can help on that level, okay? Right. So it's about 37 minutes past the hour of 2. 0302 216541. Those are the healthy buttons to push. Now, what will cause my immune system to selectively target? Because once it's selected, that's where the spiritual comes in.
Yeah.
See, but why me? Why my joints? Why RA? Yeah. Right? That's where our beliefs too come in. And then if it's not an old woman in the village and so on and so forth. What are the causes? And then alongside that, if you can tie in the risk factors.
So that is why you rightly said most people would think it's spiritual. So the direct cause is not known. What we know is that your immune system interplays with the environment.
Okay.
And then when there are some triggers, then it's triggered.
Okay.
So it's like your own immune clock,
Right.
and it's there. Somebody said this is a time bomb, and when it gets a trigger, then it switch on.
So it's there silently, right?
Great.
Okay. And then something annoys it.
Fine. I mean, I think that's also good.
Something triggers
Yes,
or annoys it, and it
yeah.
says, "Hey, you have been here quietly." Then you have some signs and symptoms now starting to show.
Great.
Okay. So what are these kinds of what are
Triggers.
possible triggers?
So the triggers could be just stress, anything that stresses you. So maybe you have an impending exams,
Okay.
or you are late for a notice program, and then you are stressful. Then it starts.
All right.
It may just come and go. You may get any viral infection, including good old COVID. Well,
So
is it
it,
old?
it can
well,
be it can be triggered by an infection.
infection.
Stress.
So viral infection, stress,
right.
sometimes pregnancy.
Okay.
Pregnancy can really trigger it, and then sometimes pregnancy can also make it better.
Okay.
So some people are pregnant and then their pains are far better.
Yes.
Some also are pregnant
I
and then
noticed
it's
that those who haven't had children are at risk, right? But those who have had children, as in women, right, seem to have some level of protection.
protection, yeah.
Right. Okay.
So being a female alone is also a risk.
Okay.
This condition is higher in females than males.
Okay.
We think that maybe it's due to the hormone estrogen
Yeah.
that men don't have a lot.
7 FM.
And then if you do a lot of smoking, then your risk is also higher.
Okay.
Alcohol risk higher.
Okay.
And then sometimes we say when you put on too much weight, obesity
Right.
may put you at risk.
Okie dokie. Right. Are there any known genetic factors? Can it be inherited?
That question keeps coming up. The first thing I tell people is that you cannot give it to your husband or your wife gives it to you.
Okay.
So
Joy.
that direct
99.7
thing is
FM.
not there. We also know that because we say it is in your DNA, which I think you mentioned
Yeah.
right from the beginning, there is a probability that, or we say that the risk for you, if any of your parents had it, is higher.
Okay.
So it's still a risk, but not direct
Okay.
translation or direct hereditary.
Right.
So we do not
It increases the probability that you may get it.
Get it.
But it's not a one-on-one thing that you
thing.
have it therefore this. Okay.
So we don't do it because the last time someone told me that, then should pastors add it to their pre-counseling test? And I said, first of all, there's no test that would confirm it or rule it out for you, and it is not direct, so you can't be doing that.
Okay.
You can't be doing that.
But
So it's
definitely-
not like sickle cell.
Right. Okay. So definitely there's something handed down.
Down.
Right?
Yes.
Something that's heritable.
Heritable.
Then
But you need environment and triggers.
to bring that
Yeah.
to life. Okay. 41 minutes past, you have 2 on Joy 99.7 FM. I'm enjoying this, but it's serious. How prevalent is it? How common is it in our parts?
So it's very common.
99.7
Most
FM.
people have not been diagnosed, and so they think that it is not there.
Doc, I'm worried.
Yeah.
Did you say very common?
Yes.
Woo.
The last time they said it's common than HIV/AIDS, but most people have heard about HIV/AIDS and haven't heard about rheumatoid arthritis.
Right.
And in our clinic, every week we diagnose about 4 new cases,
Wow.
and so the numbers keep increasing. As of
Right.
now, rheumatoid arthritis forms a chunk of the patients we see in our clinic,
Right.
and it leads to a lot of disability
Right.
if it's not managed well.
Okay.
So some people have lost their jobs, and some also is giving them a lot of emotional stress.
Yeah.
Because if you wake up and you cannot brush your teeth because you can't pick the toothpaste, I don't know how you're going to talk to somebody else and tell him about your problem.
Okay.
99.7
So there's a lot of psychological and emotional problems.
Mm-hmm.
And the pain cannot be seen on your face. So you have pain, people cannot see, and they say,
You're lazy.
you are lazy. That is the word.
Whoa. Franklin, we've done this before, but share with us because, it can progress to the... I look at your hands. Well, but we had... why have I forgotten the name? Mami Chiwa
Yes.
here
Yes.
last year. Mami Chiwa, greetings to you. And I know when I'll bring you in. So, bojidi, not tree. So, how does it affect your life? Now you know. Now you're on treatment. We'll get to treatment. If we don't get to it this week, we'll see how we slice it in, right? But how does it affect your life? This joint pain, because it progresses till it damages the joint, and then if it's the hand, the wrist, there's the actual physical deformity.
Yes.
Great.
Right? I've seen pictures that are horrible, scary, right? How has it impacted your life?
I'd say it has impacted me in every way possible. So, as Doc mentioned, it's...
let me do it this way, if you don't mind. How old are you?
I'm 36.
36, okay. And I know you're married because we talked about your wife.
Yes.
Okay. You got married was it after your diagnosis or
Yes,
before?
after my diagnosis.
After your diagnosis, right? Okay. You work.
Yes.
What do you do?
I'm an office admin.
Okay. So, folks, this is the context, right? So that we see after his diagnosis, he's still an office admin. Is he able to do and see to his obligations for which he's retained and paid as an office admin? Does it affect his relationships at home, his ability to do certain things and so on? So back to you, Franklin.
Okay, so immediately after leading to diagnosis and immediately afterwards,
Joy,
because
99.7
of my
FM.
office administrative duties, you
Right.
know, I'm mostly behind the computer.
Okay.
So now translate what I said about my difficulty having to brush my teeth
Okay.
to having to type.
Right.
So that was affected majorly.
Okay.
At the time, I was the office manager. So what it meant was that I could delegate a lot of things
Okay.
to my subordinates
Right.
or other colleagues to
Okay.
do for me because of the position I held.
Okay.
But how long is that going to last, right? Because when it gets to a certain time, there are certain things that you can't delegate, you'd have to do by
You have
yourself.
to do it yourself.
So it took longer for me to get certain things done, and that was the reason, right?
Okay.
Energy levels were low. The difficulty getting out of bed in the morning
Right.
would then affect the time you show up at work.
Okay.
So I think very early, as I began to understand what the disease meant for me, I started advocating for working from home,
Right.
even before we got to 2020 and then COVID came. So I started advocating for it because I realized there were a lot of things.
Didn't your boss just, dump you, sack you?
Also, well, later on down the line, we parted ways.
parted
I can't
ways.
say if that was the reason, but there was a certain point where we had a certain conversation.
Okay.
And she went like, "Oh, okay, so then that's why it takes you longer to get certain things done for me."
All right.
I don't know.
Essentially, what we're discussing here is the impact on, work,
Oh yeah, and it's real.
employment.
Yes.
Right.
It's real. There are a lot of people who have lost their jobs because of that. Then when it comes to the relationship, I usually say that on the relationship side, I think I shared this with you last time we were here. I had the
Folks,
opposite of
if
what...
you're watching us and you see Franklin starting to, brighten up and smile, he's about to introduce the subject of his wife. So please don't tune whatever gadget you are watching on. It is the impact of his wife. Yes, go ahead, please.
And God bless her sweet soul. So, unlike most of my colleagues, and I say colleagues, those who have been diagnosed with other autoimmune conditions,
Quite right, yeah.
I found my wife as a result of the condition, as opposed to they who a lot of people lost families, lost relationships as a result of the disease.
See the way I'm looking at you. We are talking about a condition, and the condition downloaded your wife,
Wow.
and you're happy about it. So okay.
So it's a lot.
No. How did you find her through your condition?
So out of advocacy, right?
All right.
So you would realize that. Let me put it this way. I'm the same person. So there are a lot of us, as Doctor said,
Okay.
on the support group platform for the youth.
Okay.
We are over 200.
So you're helping educate, inform,
Yes.
support each other.
Unfortunately, you see, let's say Mami comes here, I come here. You kind of see the same faces.
Yeah.
99.7
Because a lot of people, due to stigmatization, don't
Right.
want to come out and talk about it.
Advocacy has always been a lonely road.
Yes.
So we always need those who are passionate, dedicated, and they can do it.
Yes.
And that is why for anything we handle, we hear the same faces.
Yes.
Some families are supported, but they don't want you painting the walls and the speakers and the radios
Exactly.
of Ghana with your condition.
Exactly.
So in my 100 and something years of broadcasting, I always check on some of my guests because sometimes they pull back because of family response. So I don't take anybody for granted on this show. So you don't have that many people going around. You still haven't found your wife yet. We're still
and
one
so
Shami.
I took it upon myself. So Dr. Day asked, Franklin, you seem like a very affable, well-spoken person. Do you think you can do this for us? And I was like, why not? If nobody else wants to do it, I'm happy to do it.
Okay.
And my family was very supportive, so I started doing it. So it was on one of those things. In one of my groups, I invited Dr. Day to come and talk to the WhatsApp group.
Right.
And then I shared my story. And somebody comes into my DM. Oh, so this is what you've been going through, but you don't look it, blah, 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 blah. So that's where the conversation started from. And the support just kept building up after that.
She said, now you're no size dada. Right. So she was on this advocacy platform, right? And then when you shared, then she connected.
She connected afterwards.
Tell if WhatsApp hadn't come, those people with POP, which is another medical condition. Chronic. It's chronic. Some people say there's a cure, but we'll talk about that. So that's how you met your wife.
So that's how I met her.
And then you got closer and closer.
Yes.
And then the rest.
And the rest was history. She decided she was going to do this with me.
All right.
Unfortunately, other people see the other side of it. So either maybe after marriage they get diagnosed and the partner who is not diagnosed goes,
they lose their marriage.
Oh, you hid this from me. You didn't say it.
Right.
You see things like that.
So it works
that's
the
where
other way for you.
The emotional and psychological bit comes
in. Yeah.
It's it's hell for a lot of people.
Wow.
For a lot of that.
Wow.
So you are losing it emotionally, you are losing it psychologically, you are losing it physically because you can't work like you used to,
Then
and probably you lose your joy.
Franklin, sometimes you get angry with God.
Oh yeah.
Yeah.
A lot of people
Right.
have. Thankfully, I was not.
Okay.
I'm sure it's probably because of my upbringing, where I learned from a very early age, you don't question God.
Okay.
And one of the stories that, I'm a Christian, one of the stories that stayed with me that I was taught, that my mom drummed home, was the story of Job.
Right.
Everything seemed to have been going okay, not okay with Job, but like when the thing started, the story goes up until the point where he now listens to his friends and he begins to question God. Then God also says, okay, no, I'm not going to keep quiet. I'll ask you some questions.
Right.
So I've always felt like when you go to ask God that, and then he also wants to ask you questions, will you be able to answer? So if you're not be able to answer...
That is when Franklin left the group.
Exactly. Exactly.
Folks, I'm enjoying this, but it's very serious stuff. We're talking about rheumatoid arthritis on Joy 99.7 FM with Dr. Richard Doe. He's a physician specialist and he's with the rheumatology unit of the Kolebu Teaching Hospital. And you just heard Franklin Hiagbe. He's a patient advocate. He has the condition himself. And he's part of the rheumatology initiative. Try. They do a lot of education, advocacy, empowerment, and support, right? So it's not all physical. Yes, it has to be diagnosed. It is a physical condition, but it involves so many things. Psychologists, sometimes even sociologists come in and, family support, you name it, right? If you have any questions, concerns, we can still stick some in. 0302-216-541. Those are the buttons. We're live on Facebook and YouTube. Doc, this is chronic.
Yes.
Yeah.
And I say it, and I want you to endorse, confirm, or affirm. It does not have a cure. Does it?
It doesn't have a cure at the moment.
It does not have a cure. Okay? Right? I'll leave that at the moment out. Wonderful things happen. But RA does not have a cure. So the sufferers, the affected and afflicted, right, are in for what we call the burden of chronic illness. long-term illness, okay, which is a whole subject in itself. But coming back to, the problems he's talking about, whether your employer, your partner, your spouse, your family understand and are supportive, whether you have the financial resources and wherewithal to do all the things that you have to do. How do we manage it? Because very often when we do health programs, people want to hear treatment. But I'm specifically using management. Yeah. How do we manage RA?
So, management is what we say multidisciplinary.
Okay.
So we manage it, if you like, as you said, physically, spiritually, and mentally.
Okay.
What we do is that we manage the patient fully.
Right.
So if you have deformities, we would get physiotherapists to help you.
Okay.
We will get what we call occupational therapists.
Right.
To try and help you so that even if you've lost your writing, they will see how best you can relate with new ways.
Compensate and function.
And then you did physical activity, because if you don't use the joints that you think are painful, they become more painful and more stiff. Remember, stiffness already is part of the symptoms.
Okay.
And so we want you to move them. And we have people trained to do that, not just someone who massage.
Right.
And yet atamame.
Okay.
No, but a physiotherapist.
Right. Who knows what they're doing?
Who knows what they are doing.
Right.
So they
to
don't cause
understand
more pain.
Physical,
and then they understand the joints,
anatomy, all that.
All
right.
that, yeah.
Okay.
And they don't cause more pain.
Okay.
Then we give
By the way, a physiotherapist is not a physioterrorist. Some people go around in the name of massage, whatever.
Yes.
I'll come home and they terrorize people. Right? These are people who are trained, have the requisite qualifications, and they know how to manipulate and use physical movement as a form of therapy. Right? This is important. Yes, Doc, continue.
Yes. So we also give medications, and as you said, it's chronic. So at the moment we manage it. We can manage it, and you have your normal life. In fact, we want to see you early before deformities come.
Okay.
And that is how come Franklin is here, and you do not know he has a condition.
Right.
Because he's on management, and he's following what his doctors are saying. So when you are being managed, you go according to the plans that you have come to, or the conclusions you've come to with your doctor. So normally we will tell you, we will not be able to cure it, but we can manage it. You need to take medications A, B, C, and you need to be on them.
Okay.
The problem is cost of the medication.
The cost of the medications. Right. Is there any support for the costs?
So yes, we have trying to, but we need support from everyone. If try can do
not
that.
Not on national health insurance?
Most of them are not on national health insurance. The last time a patient said, no.
Okay. All right. All right. Folks, you're hearing that from Doc. This is from Dede in Maryland. She says, is meniscus degeneration a form of arthritis? Does the degeneration cause that cracking sound in the knee? Does, example, Bengay work at all on the knee for people with such conditions? What about the bandage? Noticed it with older folks.
All right.
Dede doesn't ask one question, but she's
multiple
always
questions.
very well informed and a loyal listener. So let's start with meniscus degeneration.
Yes.
Is it a form of arthritis?
Yeah, it is. It is. I mean, it's the osteoarthritis we are talking about.
Okay.
So whereas what you said, those part that soft part that you can bite, if it's a bone, they wear off, and so the bones are meeting each other.
They're hitting each
and
other.
they give you those cracking sounds.
Okay.
Especially in the knee. I'm not too sure about her Bengay, but I'm sure if it is a BAM, yes, one of the management for osteoarthritis, apart from resting the limb, is to apply some ointment. Not everyone will the ointment work for. Yes, resting it and then using some knee brace and bandages do help, but not everyone. Yes, what we believe helps most is weight loss.
Yeah.
So if you're a little bit on a high weight, you try and lose weight, and that is scientifically proven to really help with
Doc,
osteoarthritis.
at this point, I have a very stubborn academy listener called Naki.
Yes, please.
Yes, dealing with some form of arthritis, but quite stubborn, right? Some of the creams and things like Bengay and things have been prescribed. Some of them are topical creams.
Yes.
Right? Some are, oral medications. But the mention of weight loss, exercise is where the stubbornness comes in. So I'm glad you are hitting on this.
Yes,
because you want to reduce the pressure on those joints as well. Okie dokie. And then she talked about bandages. You mentioned those.
Yes.
Supports for the joints.
Joints, yeah.
Okay.
So they do help, but not everyone. So as I said, I mean, as it's a difficult condition to manage and live with.
Okay.
But as we said, if you try and lose some weight, and as somebody said, if I can't move, how do I lose the weight?
Right.
And so that is why you need to see the physiotherapist.
Okay.
They help you move the joints that you think are painful.
All right.
And you get over them. And then you see a dietitian as well.
Okay.
And then you do not put on too much weight.
All right, Doc. Very quickly, we're almost out of time. There are periods when Franklin and people like him are free of the challenges, the symptoms, and so on and so forth. And then it comes back. Is that what we call a flare-up?
Yeah.
In sickle cell, we'll say crisis and other
Yes.
things. With RA, what is that?
So it's also known as a flare.
Okay.
So there are times that they have flares and there are times that they have remission.
Okay.
And in fact, the aim of our management is to keep the individual in remission for a long time.
All right.
Or permanently.
So reduce the frequency of the flare-ups.
Flare-ups.
Okay.
And flare-ups may come up if the person do not adhere to management plan.
Okay.
Medications. Most people take the medications, and as we said, it's chronic. They say, I am tired.
Okay.
So we don't want anyone to say, I'm tired. It's a condition that you can manage. I tell people, if you are tired, then stop eating. You've been eating from the day you were born.
You didn't stop.
You do not intend to stop.
All right. So if it's a chronic problem, you must stick with the management.
Management.
Okay.
And then also do not overstress yourself. So
Right.
the days that you have less pain, don't do as if the condition is gone.
It's there.
Yeah, so
Right.
you don't climb the steps up and down just to show to your boss
Okay.
you are now
Better.
better.
Okay. Right. Just quickly, 1 second or one brief second, Franklin. So are you working, are you self-employed now or working under a different boss?
So I've worked under 3 different bosses till now. I think my last contract just ended in December.
Essentially, what I'm looking for is, now that you have a diagnosis, have you related this, disclosed this to your boss, and do you get certain accommodation? Or
Yeah. So I'll say actually for me is one of the main things I mentioned.
okay.
So my next bosses after that initial one, it was one of the things on the table. So during the interview, off the bat, they need to know.
Right.
Yes.
Okay. All right.
And I'll say all of them have been accommodating about it. And getting into the world of virtual work was even a blessing in that sense.
Okay.
Yes.
Great stuff. We're out of time, but I will bring them back because we need to look at living with RA. Should I say forming a workable therapeutic contract with your physicians, your doctors, your specialists, and managing all this burden and your emotional response to it. There's a lot we need to talk about with Dr. Richard Doe and Franklin Hiagbe. Franklin has some lovely Labrador puppies. I'm trying to use psychological techniques to get 1 or 2 from him. He tells me he breeds. So if you need a puppy, call me. We will go to Franklin and we'll do puppy love, puppy advocacy. And we'll grab that. Doc and Franklin, many, many, many thanks. I know so many people suffering from this condition. Sadly, I know those who've suffered some of the extreme consequences, divorce or loss of relationship, loss of job security, unemployment, you name it. Some even get to the point they are suicidal.
Yeah.
So we'll get into that. Many thanks for enriching our programming.
Thank you.
Right?
Thank
And to
you for
you, my
having us.
loyal, discerning listeners, this is Ghana Month. We'll be coming up and trying to give you a stir fry or buffet of Ghanaian culture related to health. Those were asking about Ailo and other things. Please, some of the names for our foods, but what is in them and the beliefs around them, you'll be amazed. Take and stay on Joy 99.7 FM. My name is Nortey by nature. This has been Ultimate Health. Easy to digest, well prepared. By Abeku Kofi. He's in the kitchen. But I'm out of here. Stick and stay on Joy 99.7 FM. I'm out.